The U.S. contact tracing is also a major concern as new cases of the virus outpace the nation's ability to track who infected people may have come into contact with. Since the start of the pandemic, more than 155,000 Americans have died from COVID-19. But across the country, a growing backlog of coronavirus tests has further exacerbated the issue of tracking and tracing those infected with the deadly virus. The New York Times recently published an article, "Contact Tracing is Failing in Many States. Here's Why." It explores why the U.S. is having such a difficult time containing the coronavirus outbreak on a national scale and alternative methods of addressing the pandemic. Joining me now is Jennifer Steinhauer. She's a reporter at the New York Times and the co-author of that article. Jennifer, welcome. It's great to have you with us. So we keep hearing that contact tracing is essential to containing the spread of COVID-19. So as a nation, why are we struggling so hard to track and trace the virus in most places? And are there places in the country where the tracking system is actually working?
It does vary from state to state and locality to locality, but you have to think of contact tracing as a component, not some in and of itself method of preventing transmission and spread of the virus. And it's dependent on two things. It's dependent on not having an explosion of cases in which you can't keep up with, contacting every single person who's been around somebody when you have, tens, thousands of people in a community who are hit, and also on a good testing system. If you get a COVID test and you don't get the results for 2 weeks, that's almost useless to a contact tracer.
So, according to your article, many experts are saying contact tracing is so far behind in most places, it's been essentially rendered useless. Is this an exercise in futility in most states?
I think that you asked before about some place that's doing it well. In Navajo, Arizona, which is obviously a very small county, they've been able, working around the clock, to get into contact people within 24 hours, 48 hours of being tested positive. And they're able to get in a small community like that, where you don't have massive community spread. You're able to get in contact with everybody. And also, what's interesting about their approach is that it has a lot of carrots and sticks. They keep up with people to make sure that they're staying at home. In some cases where people refuse to comply with local orders, they even send the sheriff. So there's a whole continued process that goes on there. But if you talk to experts about contact tracing, in particular, Tom Frieden, who used to head the CDC, who's a huge proponent of contact tracing, even he will say you have to get the virus under more control. You have to reduce caseload. And so in those cases, in communities, public health dollars and energies are probably better spent on the basic efforts that we all know about: encouraging mask wearing, social distancing, trying to contain the virus through behavior, before you can really start to use methods like contact tracing.
And don't the experts you spoke to also say one of the big problems is the lag in getting testing results? Because there's such a, until you know who has it, it's very hard to say who may be asymptomatic, who may be spreading it. It almost seems that we have to get the testing up to speed before the tracing systems can work.
That's absolutely right. Contact tracing cannot work if you have a broken fundamental COVID testing system, because, as you point out, if you have 14 days that go by, how is someone supposed to remember who they were in contact with 14 days ago? We can barely remember, one day from the next now. Asymptomatic spreaders are a huge piece of this. So, of course, people being home and being sick is not enough. You have to know where they've been. Then when you have that much backlog, then you have 10, 20,000, 100 other people behind you also testing positive and needing to be traced. So it's just really, it's trying to put raindrops back into the cloud at that point. So contact tracing, it cannot be said enough times, is only a component of and an outgrowth of an effective and healthy overall COVID-19 testing system.
A system that we need to get our act together soon. Well, Jennifer Steinhauer of the New York Times, thank you so much for joining us.
Thank you for having me.